I think it's so cool to have a theme song. But I have to tell you that Councilman Herndon's is so much cooler than mine. I got back from Africa last night. I spent the Thanksgiving holiday celebrating the Thanksgiving holiday with 18 Ugandans at our research center that we have in southern Uganda. And the most part of the day was spent trying to explain to them why we would kill 3 of their turkeys and stuff it with breadcrumbs that I brought from Safeway. We spent the evening eating our dinner, trying to explain to them why we would put marshmallows into the squash and yams that we eat, and trying to help them understand why no Thanksgiving feast is complete without the green bean casserole with the cream of mushroom soup and those crispy onion things that you buy at the store. We had a phenomenal Thanksgiving holiday together, and as I looked around the table at these 18 Ugandans, I realized that what they taught me over the last year as we brought them on board to run this center is they taught me the importance of thinking big, and they taught me the importance of thinking differently. And I started thinking back as I was putting this talk together today, that those 2 lessons were ingrained in me from pre-Urban Peak days, and that over the last 10 years of the work that I've been doing in this community with many of you all in this room, that those lessons have come to life in a number of different ways. Going back, I look back at how I ended up where I am. I was going to be a surgeon. Since the 2nd grade, that's what I wanted to do. I wanted to be fabulously wealthy, and I wanted to be a surgeon. I modeled myself after Hawkeye Pierce, and was committed to doing that up until about the 11th hour of my senior year in college, when I decided that might not be exactly the path that I should take. And I talk about the fact that by not becoming a surgeon, I truly believe that I saved lives. I ended up going to Tulane, where I started working on my master's in international public health. And it was my first trip to Africa, where I did my thesis on a malaria project, and I saw poverty on an international scale at its ripest. I came back and I did my 2nd master's in sociology, and I started working with inner city heroin addicts in New Orleans. And it was at that time where you literally saw where the shit rolls off the edge of the earth in your own community. That you saw the poorest of the poor. People have asked me why I ended up doing the work that I do. Was I homeless or what happened to me? And I remember the young person who was sitting across from me when I was doing a study for the CDC in graduate school. He was 22 years old, and he was brilliant. He was charismatic. He was smart. And he was shooting about $300 worth of heroin a day. And I looked at him and I thought to myself, my gosh, if that person had been born into my family and I'd been born into his family, I'd be shooting $300 worth of heroin a day and probably looking for my next hit by prostituting myself. And he'd be wondering where he was going to get a beer after he was done doing the interview so he could get back to class in time and finish his studies. And it was that point, that whole cliche of to whom much has been given, much is expected, that I decided that I'd spend the rest of my life working for the poor. And so I came back to Denver, and I landed at a place called Urban Peak. Urban Peak, for those of you who don't know, is a homeless and runaway youth shelter. And there were about 6 of us there, and the leader at Urban Peak was a woman by the name of Roxanne White. And Roxanne White not only became my best friend and my mentor, but she and I have worked together for the last 15 years. We joke about the fact that she's been the longest, most stable relationship in my life. We spent 6 years listening to the private sector and to the public sector and learning what it would take for us to take homeless youth and transition them off of the streets and into housing. That how do you take a kid on the 16th Street Mall who's shooting heroin and connect him with services and treatment and housing and transition them off the streets into employment and stable living. And we learned a lot. And we built 100 units of housing, and we learned that you could innovate solutions to poverty. That sometimes we overcomplicate our complex social issues and that they are more solvable than we think. That at Urban Peak we started thinking differently and we started thinking big. And then along came a man by the name of John Hickenlooper who, when he became mayor, took Roxanne over to the Department of Human Services, and I followed shortly after to run Denver's Road Home. The 10-year plan to end homelessness. People laughed about it. For 2 years, we had to talk about the fact that we named it the 10-year plan to end homelessness. People wanted to know, why wouldn't we just call it the 10-year plan to help homeless people? That why wouldn't we call it the 10-year plan to ameliorate homelessness? Are we that crazy to think that you could possibly end homelessness in a community? And we did a lot of thinking, and we put together a 10-year plan. Roxanne responded to people's comments when they'd say, well, why not call it the 10-year plan to ameliorate homelessness, with the analogy of what would have happened in the 1960s when John F. Kennedy came on TV and said, get excited, we are going to go halfway to the moon. That we went all the way to the moon, and we went all the way on homelessness. That over the course of 6 years, we didn't just listen, but we thought with our community, with the people at the chamber and our business leaders. We thought with Christine Bonero, who created a space for us to be able to move the dollars from Denver's Road Home through the Mile High United Way. We thought with Barbara Grogan, who was actually the first first woman chair of the Chamber of Commerce, who helped us figure out how to allocate those funds into the community. And over the course of 6 years, we raised $50 million. We built 3,000 units of housing. And we saw a reduction in chronic homelessness of 65%. That a community that doubted that we could actually make an impact or move that needle, we started to see change in amazing ways. That our community, the people in this room, the people at the chamber and our foundation community, our homeless people who we invited to have a seat at the table, thought differently, and they thought big. And in doing so, we saw detox census go down. We saw our jail census go down. We saw our emergency room census go down. And we made the case that ending homelessness wasn't just the right thing to do, but it was the smart thing to do. That we had a community that was willing to think differently and think big. And I started to wonder, if we could do that in our own community here in Denver, what does that look like on the international level? In 2006, I was fortunate enough to be part of the inaugural class of the Bonfils Stanton Livingston Fellowship Program. I was given a fellowship award, and the Bonfils Stanton Livingston Fellowship Program was the brainchild of a man by the name of John Livingston, who passed about 5 years ago. John Livingston was part of the private sector. He understood the value of the chamber. He understood the value of networks. And John Livingston said, we put millions and millions and millions of dollars every year into our nonprofit community, that we invest in our nonprofits to impact change, but we don't invest in our leadership. That in our private sector, if we want to incentivize change, we can do it through dollars. We can send them to Harvard. In our nonprofit community, what are we doing to incentivize and to grow our leadership? And so I was fortunate enough to be one of the Livingston Fellows. And what I decided to do, I did three things. I wanted to finish my dissertation at the University of Colorado. And I wanted to grow my network in the business community. And so the fellowship allowed me to engage in LEX, and it allowed me to engage in Leadership Denver, and it allowed me to engage in the dialogues that the chamber does so well in terms of connecting us all together to solve those complex social issues. And as a final aspect of it, I decided to look at the international dimensions of youth poverty. I'd heard a clip on NPR talking about the child soldiers in northern Uganda. And after the Civil War, how they were reintegrating young people who had killed their families and killed their community members. And how do you reintegrate those young people back into their communities after an awful tragedy like war? And I wanted to go see how they were doing it, because they were clearly thinking differently, and they were clearly thinking big. And so I went to Uganda in 2006 and met a woman by the name of Shane Gilbert, who was running a local grassroots nonprofit called Come Let's Dance. She was working with women and children in the slums. And I spent some time with her, and then I hired one of her kids to take me up to the north to see where the child soldiers were being rehabilitated and reintegrated in their community. And I saw a jungle clinic and how people were being treated with health care. I went along the Congolese border and I stumbled upon this beautiful place in southern Uganda. It was a lake region called Lake Minyoni, which I'll talk about a little bit more, but it was where rural Uganda was alive and well. And I crossed over and I saw in Rwanda where poverty and conservation were mingling with one another, and how that could actually help drive people out of poverty. How the private sector, through tourism dollars and through the rare mountain gorillas, was actually helping pull people out of poverty and employ them. And then I went down to Kigali and I saw what happens to a community when you exterminate 1/3 of your population in 3 months, and how a community has to rebuild and recover and forgive. And I went back to Shane and I said, I want to do something here. I've fallen in love with Uganda and Rwanda. What can I do? And she looked at me and she said, don't do anything. She said, Africa is filled with us coming over here and acting without listening and thinking first. She said, before you go build schools and before you go build medical clinics and before you ship books and laptops, she said, do with other people in your community what you've just done. How do you take them and have them experience the same thing that you just experienced? To listen in these communities and to think in these communities before we act. And so in 2006, the Global Livingston Institute was born, and 6 years later, we've taken over 200 students and community leaders to do just that. We've taken the Kaz Matthews and the Barb Grogans and the Alex Sheffrons, who is in the audience today, to listen and think before we act. And some amazing things started to happen. About a year and a half ago, as the Global Livingston Institute was coming to life, I decided that we needed to think bigger and we needed to think differently about the work that we were doing. And so I did what any reasonable, rational person would do. I bought a peninsula. And you're going to hear about that as I talk. And this peninsula is in southern Uganda, and I said, wouldn't it be interesting if we created a space for people to listen and think and act? That I thought about the Aspen Institute, that has a place for heads of state and foundation leaders and corporate leaders to come together to solve complex social issues. And I said, what would happen if we created a poor man's institute? Poor man's Aspen Institute. What would happen if we created a space for our community leaders and our refugee workers and our students to come together to solve complex social issues? A space for people who don't usually get invited to sit at the table to solve some of our most challenging poverty-related issues. And so when Tutsi started to come about, we learned a lot as we went along the way. And I want to talk a little bit about that, because as we listened and we thought and we acted on this notion of what it would take for us to impact change, we learned some things along the way that we didn't anticipate. That when you take $350,000 of private sector money, a lot of those dollars from folks in this community who have actually made this community strong, the Peter Beaupreys and the Brad Bussies and the Barbara Grogans, helped us create this center. And when you invest $350,000 in a community and you hire 150 local individuals to help build it, something amazing happens. That these 150 people actually started gaining an income, that we started investing in the people. So instead of telling them that we're going to build a school for them or build a medical clinic for them, we employed them. And that along the way, I remember sitting at a cabinet meeting, and my partner actually lives over there right now and has been helping build the center. And he sent me an email, and he said that we needed to buy a semi-truck to move goods from Kampala down to Kibale. And I remember thinking when I got that email, I thought, well, buying a semi-truck will be by far the most manly thing that I've ever done. And then I thought to myself, I thought it was kind of hot that my boyfriend wanted to buy a semi-truck. But we bought the semi-truck, and what was really cool about it was that semi-truck wasn't just about moving the goods from Kampala to Kibale, but we employed 2 people who didn't have jobs. That what we learned from that semi-truck is that there was a business that if you engaged the private sector and you invested in the community, that you could make the trucking business less corrupt and more safe, and that you could engage people in employment so that they can make decisions for their own families. And we learned a lot through how you engage those dollars and how you invest in a community. We started thinking bigger, and we started thinking differently. That we hired 18 local Ugandans to run the center. The Ugandans that I had Thanksgiving dinner with, none of these individuals had ever had a full-time job. That when we hired these individuals, we said, we're going to pay you 30% better than anybody in the region. Then we said, we're going to actually give you an extra day off so you have more time with your families. And we said, we're going to pay for your health care so you have access to health care. And we ignited a fire in this community, that this community came to own what we've developed here. that they're helping us through a reciprocal relationship to address and to respond to complex social issues. That these individuals, these 18 we employed, taught us that if we invest in them, they know how to invest in their own communities. I talked to them the day that they got their first payroll. I watched them walk out with their first paycheck. I talked to Thomas, who actually went and bought, Thomas was 22 years old. As soon as he got his paycheck, he went and bought a cow. He went and bought a cow for his family so that they would have it for the future, and then he spent the rest of the dollars on education. Bright, who took it back to his village, paid for his mother-in-law's health care and is helping finish build his house. That these are people who don't need us to tell them what they need. They'll figure it out if we can help employ them and we can help engage them. That the role of the private sector in solving our complex social issues, both in Africa and here in our own community, will have multiplying effects if we figure out how to engage it and bring folks to the table. And so as we wrap up this conversation today and we talk about what it means to listen and think and act, as we have this conversation about thinking bigger and thinking differently, I want to end with a story. Last summer, we had our first women's fellowship retreat. Dr. Alice Madden, who used to be the Worth Chair at the University of Colorado, Denver, Elisa Speranza, who's over at CH2M Hill, and Marcy Prokopek, a philanthropist in the community, came over from the United States to lead a women's retreat. And we invited 10 women from the slums of Kampala and from Kabale to be part of this conversation as part of the Fulbright that I was working on to build the relationship between the University of Colorado, Denver, and McCary University. And I was getting ready to go. It was a couple of days before I was supposed to leave. And this will be a shock to some of you, but I was late for lunch. And I showed up at the luncheon, and I was actually at the head table. And I hurried up to the head table, and I sat down. And I was a bit frenetic, and I looked at the table, and there in front of me was a name card, and the name card had my name on it in calligraphy. And I sat there and I started to think about the retreat that we were hosting next week. We were inviting 10 women to be part of a conversation about what it meant to invest in women's leadership. And I thought to myself, my gosh, I wonder how long it took this person to write my name out in calligraphy and to create this space for me at the table. And then I started to think about all of the different seats at the table that I had been invited to just in that week. That as you all go into the holiday season, think about how many different places that you're going that you've been specifically invited to come to. Think about how many seats at the table have been created specifically for you to make you feel important. And I started thinking about these women. We'd invited 10 women who've never been invited to have a seat at any table. That how do we create a seat at the table for the people who we need the most to solve our complex social issues? And so as you go into the holidays and as you sit around the dinner table or at your next board meeting or when you're volunteering at the nonprofit that you work with, the request that I would have is in your takeaway from today's conversations is how do you challenge the folks at your nonprofit or in your community or in your boardrooms to think differently about our complex social issues and to think big. And if it's healthcare or if it's education or if it's homelessness, if it's local or if it's international, ask yourself over the holidays and as you're thinking about the work you're doing, what will it take and what is it that will ignite your fire? Thank you very much.